Hi, everybody. I promised you some updates on health news as it came in. Let's start today with the MMR and measles. All over the news, of course, is the controversies and news about the measles outbreak in Texas. I'm going to be quick today, but there will be more details on our YouTube channel with a longer version of this story. There were a couple things that have been said about this situation. The first thing I want to say to my families in Ohio is we have no active cases in the state of Ohio right now, and most of them are concentrated in a highly unvaccinated group in the south on Texas and New Mexico. This is how most outbreaks happen. Because the vaccine is 93% effective on one dose and 97% effective on two, it is a truly sterilizing vaccine in that once you catch immunity from it at the 97% rate, you cannot catch it, you cannot spread it, because it is a live virus, meaning that you actually catch a little bit of measles with the virus. So you create exactly the same kind of immunity that you would catch if you had natural measles, which was one of the things that RFK said this week that was really concerning. When he was on Hannity last week, he said that the natural immunity, if you'd gotten measles wild, was better than the immunity from the vaccine. But they're actually the same exact immunity. The measles vaccine carries a live version of measles, which does not mutate quickly. And so therefore, you actually catch a little bit of the illness, which is why there's a high fever and rash and side effect profile with the MMR, is because you're actually catching measles in a very small dose during that vaccination. So it creates the same immunity that it would create if you had been given it to it. It is true that our titers and our immunity to it has waned over time since a vaccinated population. And that's actually because when measles or chickenpox were live in the community, grandparents, moms, dads were all caring for their children, and it kept their titers really high. So post-vaccination, we did actually end up with less immunity in the older population in their measurable titer levels. But that's not because of vaccines or natural immunity. That's just what happens when there aren't children running around with measles. The good news is your B cells store that memory. So upon exposure to that virus, you will kick out titers again. So we don't really have any, substantive amount of research or data to support the idea that older people are catching measles because of waning titer levels, even amongst healthcare workers who care for patients with measles. So you don't need to worry if you've been vaccinated as a child, and especially if you've had titer confirmation of conversion, you're good and you're protected. We don't need to run around or get any boosters, which is one of the other things that has been being said that's also false. Adults do not need boosters unless they have documented lack of efficacy of their vaccine. Do we need any in Ohio right now? Well, if you haven't gotten your primary series and you don't want to catch measles, then you definitely should come in and get vaccinated. If you have your two vaccines and you don't have any trouble, no worries, no rush. Hope that helps.